All right, everyone, settle down, settle down. Chala, let's get started. Today we're going to talk about something you all think you're experts on, vitamins. But I promise you, by the end of this class, the way you think about that simple multivitamin is going to change completely. This is important for your future practice, so pay very close attention. So let's start with a big question. Can your multivitamin, the one you might even be taking every day, be toxic? I mean, most people think, all right, it's just a vitamin, no? How can it be harmful? But that's where the danger lies. The reality is, it's not so simple. And for you, as future doctors, understanding this difference is, well, it's everything. Always remember that famous line, the dose makes the poison. So what's on the agenda today? First, we'll talk about the real dangers, when a good thing becomes too much. Then we'll dive into two very important case files, looking at vitamin A and vitamin E specifically. After that, we're going to bust some myths. Separate the marketing hype from the actual science when it comes to antioxidants. We'll also quickly cover the B vitamins, and then we'll wrap up with what you should actually be telling your patient.
Okay, first up, a dangerous dose. This is the absolute foundation for everything we're discussing. It all comes back to that one single principle you learn in pharmacology. You know the one, the dose alone makes the poison. And believe me, when it comes to vitamins, this isn't just a saying. It's a critical warning.
You see, a lot of vitamins have what we call a narrow therapeutic window. What does that mean? It means the difference between the dose that helps you and the dose that harms you is very, very small. It's like walking a tightrope. A little bit is essential, it's life-saving, but just a little bit more can push you right over the edge into toxicity. So let's look at our first case file to see this in action. Vitamin A. This is a classic example. We all know it's absolutely vital for things like your vision, for growth, for keeping tissues healthy. But, and this is a big but, it can also be seriously dangerous if you get too much of it. Now, this is very important for your clinical practice, so listen up. Look at the difference here. You have chronic toxicity and acute poisoning. A patient who's been taking a bit too much for months and months will come to you complaining of things like hair loss, achy joints, maybe they're irritable, but if someone takes one giant dose, they'll show up in the ER with a blinding headache, they'll be drowsy, and their skin might even start to peel off. It's the same vitamin, but two totally different clinical pictures. You have to know this.
Just look at that number. Over 1 million international units in one single dose. That's enough to cause acute poisoning. And this isn't just some textbook theory. This has actually happened to Arctic explorers who ate polar bear liver. Why? Because it's packed with an insane amount of vitamin A. It's a real-world example that shows you just how powerful and how dangerous this stuff can be.
So how on earth does one vitamin do all this? Well, it gets right into the cell's headquarters, the nucleus. It activates something called retinoid receptors, the RARs and RXRs. Now, think of these receptors as the ultimate command centers for the cell. When vitamin A flips their switches, they start changing which proteins get made. And that leads to massive changes in the structure and function of your tissues. It's incredibly powerful.
Okay, let's close that file and open a new one. Case file number 2, vitamin E. This one's a superstar, isn't it? Everyone's heard of it. The great antioxidant, the guardian of our cells. But what does that really mean? Let's peel back the layers and see what's actually happening on a clinical level. Before we can understand vitamin E, you have to understand its arch nemesis, the free radical. So what is a free radical? Imagine it's like an out-of-control spark from a fire. It's unstable, it's highly reactive, and it's desperately looking for something to latch onto. When it finds something, like a cell membrane or even your DNA, it causes damage, and that damage starts a chain reaction, like one spark setting a whole forest on fire. And this is where our hero, vitamin E, makes its entrance. You have a free radical that's just been created. It's about to attack a cell membrane and start that fire. But just in time, vitamin E, or alpha-tocopherol, jumps in the way. It basically sacrifices itself to neutralize that free radical, stopping the chain reaction cold. It's like a tiny little fire extinguisher at the cellular level. It's a really elegant system, isn't it? Okay, now we get to what is probably the most important part of this lecture for you as future doctors. You need to be evidence-based. So we have this beautiful, elegant theory about vitamin E, right? It makes perfect sense. And the marketing companies, oh, they loved it. They took this idea and ran all the way to the bank with it. So now, let's do our job. Let's separate the hype from the hard reality. Come on, you've all heard this a million times. You see it on the box, you hear it in the ads. Take vitamin E. It's an antioxidant. It will protect your heart. It will prevent cancer. I mean, based on the theory we just discussed, it sounds completely logical. It makes for a great story. But as scientists, we have to ask the most important question. Is it actually true?
And this table says it all. This is the big showdown. On one side, you have the promise, the theory. It'll protect you from heart attacks and cancer. And on the other side, the evidence. The results from massive clinical trials with thousands and thousands of patients. And what did they find? No benefit. Nothing. Zilch. It did not prevent cardiovascular events. It did not prevent cancer. The beautiful theory just fell apart when it was tested in the real world.
But wait, it gets worse. And this is the part you really need to remember. It wasn't just that it didn't help. Some of these huge studies actually started to show signs of potential harm. That's right, harm. High doses of vitamin E were linked to a higher risk of congestive heart failure. And remember vitamin A? High doses were linked to more hip fractures in older women. This is why you can never, ever just tell a patient, oh, just take some vitamins, it can't hurt. It can.
Okay, let's shift gears a bit. We've talked a lot about the fat-soluble vitamins. Now let's look at the water-soluble ones. This is your bread and butter clinical knowledge, stuff that will definitely show up in your exams. So let's meet the B team, starting with thiamine, B1, and riboflavin, B2.
For thiamine, you absolutely have to know the two types of beriberi. It's a classic exam question. You have dry beriberi, think dry nerves, so you get neurological symptoms like numbness, weakness, that classic wrist drop or foot drop. Then you have wet beriberi, think wet with fluid, so you get cardiovascular signs like palpitations, swelling, and even high output heart failure. If a patient comes in with these symptoms, B1 deficiency must be on your list of possible diagnoses.
And what about riboflavin, or B2? Here you're looking for very specific visual signs. It's all about the mouth. You'll see these painful cracks at the corners of the mouth. We call that angular stomatitis. They might have a very red, sore tongue. Mouth ulcers. If you see this cluster of symptoms, a little alarm bell should go off in your head, and you should immediately be thinking about a B2 deficiency, a riboflavin.
So, where does that leave us? We've seen that too much of a vitamin can be poison, and too little can cause serious disease. So what is the answer? What is the final prescription you should be writing for your patients who just want to be healthy?
Here it is. The answer is simple, but it's not found in a bottle of pills. The scientific evidence is absolutely clear on this. The real prescription for health is a healthy lifestyle. It's eating enough fruits and vegetables to get your vitamins naturally. It's regular physical activity. It's keeping your weight in a healthy range. And it's not smoking. This is what's proven to save lives. Those high-dose antioxidant pills, they're not.
So I'm going to leave you with this one final thought, a question for you to take with you. When your patient sits in front of you one day and asks, "Doctor, what should I do to be healthy?" What are you going to prescribe? Are you going to recommend the fancy pill that the marketing companies are pushing, the one with no real proof? Or are you going to prescribe the lifestyle changes that we know for a fact can prevent disease? The choice you make will say everything about the kind of doctor you're going to be. Think about it. Thank you.